Welcome back. We now put the spotlight on the way forward. We are halfway through our lockdown, quickly approaching that 14th April deadline. What happens after that? Are we ready to get into a mode of lifting the lockdown? Should we have a staggered approach to this? Should we focus especially on the zones that have now been identified and further will get identified in the next 1 week as the hot spots, and only have a lockdown in those zones? Some of the questions that I will be asking our experts, and we've got the biggest of the experts joining us on this special broadcast. Now keep this in mind, viewers, that the Prime Minister Modi actually held a video conference with the state chief ministers a few days ago, and he asked all the state governments to look into this option, and he said we need to devise a common plan for the post-lockdown time. We need to have a common strategy. Not just that, today, in fact, there was an empowered committee meeting that was held in the North Block. It had officials from the Home Ministry, various other ministries, including as well as the Niti Aayog, a wide-ranging representation, including railways, to discuss what should be the way forward. Now, for example, here is something perhaps that we can look at, and experts have spoken about it. So far, of the over 700 odd districts that we have in our country, there are roughly about 230 districts that have seen cases of corona. Now, obviously, we've not tested everywhere, so there is a possibility that more than these 274 districts, there are others with coronavirus patients already. But 274 districts out of the 718 districts in our country so far have coronavirus patients. Of this, data suggests that 80% of the cases are actually coming in from only 62 districts. Only 62 districts constitute 80% of the cases out of 718 districts that we have in our country. So is it possible maybe to look at a deeper, longer term lockdown or restrictions for these specific areas, while we begin to then see a staggered relief in restrictions in the rest of the country? What should really be the way forward? That's all we are going to understand this evening with our guest joining us right now. Dr. Pinto, consultant pulmonologist with the P.D.Hinduja Hospital, joins us this evening. Dr. Preeti Kumar, Vice President for Public Health System Support at PHFI, with us this evening. Dr. Laxman Jessani, consultant for infectious diseases at Apollo Hospitals, and Dr. Sanjay Pujari, he's the Director for Institute of Infectious Diseases. And in fact, I'm going to start with Dr. Pujari to begin with. Dr. Pujari, what do you think should be the way forward? Of course, we are still about over a week away from the lockdown ending, but what could be the possible options?
Okay, so before we really look at the options, we need to realize one very important thing, that this is an unprecedented situation, and there is probably nobody who has seen anything like this in their lifetime. Neither do we completely understand the behavior of the virus, particularly its seasonality or its survival in the Indian summers. So it would be very sensible to plan for the worst outcomes, and therefore there is no perfect exit strategy right here. So our understanding of the best response really will evolve based on how the epidemic evolves in India as well as the rest of the world, from where we can really look at important lessons. But purely from speaking from the scientific and epidemiological point of view, and I'm not going to really focus on the socioeconomic aspects of it, there is currently hotspots where we need to really focus on continuing to slowing the spread of the virus. And this is achieved by strict physical distancing measures, which can include stay or work at home. This can be volitional, or this can be implemented very aggressively, improving diagnostics testing, ensuring that hospitals are ready for critical care, and establishing comprehensive surveillance systems, and massively scaling up contact tracing, which the government is doing excellent in trying to really contact trace each and every patient, try to isolate the patients, try to quarantine their contacts. You can perhaps look at technology like GPS tracking. And most importantly, I think, is to encourage public to wear homemade masks, because there is some evidence to suggest that there is a lot of asymptomatic shedding of the virus which happens, and that is the reason why everybody should perhaps look at trying to wear homemade masks to prevent further transmission of the virus. Now, for the non-hotspot zones, uh, that lockdown should perhaps be looked at being phased or graded opening of the lockdown, and this could ensure that after ensuring that these zones have the capacity to contact trace, to do massive testing, to have the capacity to treat these patients in case there is a re-emergence of the virus in these non-hotspot zones. Physical distancing needs to be continued, mass gatherings needs to be avoided, and as I think we should, particularly in this non-hotspot zones, try to focus on vulnerable population, like trying to advise the elderly to not mix up or limit time in the community, and that is very important. Try to scale up public hygiene, particularly repeated sanitation of sanitizing of shared surfaces, and again use of non-medical masks. So I think these are some just some scientific and epidemiological ideas. I really don't know how we can really look at the socio-economic consequences of it, but the underlying principle is community involvement and community support is going to be crucial, and this is something the government has been able to get, and we are seeing good results of the community support, and essentially each and every individual has to contribute to this fight against the coronavirus.
But Dr. Puchari, before I go on to our other panelists, let me ask you this question. What you're saying, all of these options that we have and we could look at, is this a month from now or 2 months from now, or could it be an option that we look at a week from now?
Yeah, so essentially, if you look at the ideal definition of when cases start to decrease, when do you define that the epidemic is continuing to decline, is when you actually see a decline of cases which happens in whatever zones you are talking, which is a sustained decline over a period of 14 days. That is the incubation period of the virus. So this is the ideal kind of a situation where you actually then would be reasonably sure that there may not be a re-emergence of the virus.
Okay, interesting point, well taken. Let me actually go across to Dr. Preeti Kumar and ask Dr. Kumar about what could be the possible options. Do you agree that once the data begins to show a turn is when we can start looking at specific hotspots and zones and stricter restrictions only for those zones? I don't think Dr. Preeti Kumar can, we were able to get through right now. I'm going to just take that question across to Dr. Jessani. Dr. Jessani, would you want to respond to that question?
See, first of all, we have to understand what are the various exit strategies which we can adopt. So, whatever the epidemiologists have studied, there are various exit strategies. One of the exit strategy was what they are planning to do in Israel, is where you divide the population into two parts. One half of the population will be released from lockdown. The other one will continue with the lockdown, and then after some time reverse it. Use the other one as lockdown, and the other one will get on with the usual life. That is one strategy. The other strategy is a staggered exit strategy. The other strategy is like release the lockdown for say 10 days. So 10 days would be working, and after that again impose a lockdown for another 4 days, and again after that again release the lockdown. So that is like a check to see whether if the viral infection is spreading, then we are again enforcing a lockdown. But what I feel in our country, what we have to follow is a staggered exit, in which we need to first identify what are the hotspots. So as you rightly mentioned, there are few districts which are the main areas of hotspots. So you have to make sure that the lockdown is released very slowly from these hotspot zones. The make sure that the other non-so hotspot zones, they can be released very quickly, but from these hotspot areas, the exit should be very, very, very slowly. Secondly, when even the lockdown is released, some of the vulnerable population like the elderly people, diabetic people, I feel still they should be told not to get out of their homes and to use the social distancing principles still effectively. So in that way, what will happen is the vulnerable population is protected. And finally, what I feel we should follow is what the South Korea strategy they have done is trace, trace, trace. So what they did is they did multiple testing of all the people. They found out who is the primary focus, who are the contacts, and they did the contact tracing. So once you do a proper contact tracing, you know when to isolate and when to maintain the quarantine. So I think the South Korean strategy should be used in our setting as well, provided we are able to do adequate contact tracing, which I feel so far we have done quite nicely.
Okay. All right. So let me actually talk about this data point that I picked up today, and it's there in the Indian Express and many other places. They've crunched the numbers to show Dr. Preeti Kumar that 80% of the cases are actually in just about 60 to 65 districts right now. Of course, we've not done a very far-reaching nationwide testing, and perhaps that needs to be done before we figure out the next strategy. But would it be an option to say, okay, for these districts, perhaps we continue with a larger set of restrictions, but in other places where the infection has not spread at a large scale, we could look at lifting the restrictions in a week or 10 days from now?
I understand from where you're coming, because it is true that most of the cases are actually concentrated in a limited number of districts. See, the country is so huge. It's huge in terms of population, in terms of distribution, in terms of the way our urban, rural, urban slums are organized. So a graded response will be absolutely the strategy to move ahead. And it's a test and trial. So suppose one of the earlier speakers was talking about South Korea. Of course, South Korea did a great job with testing, but they're again seeing an uptick in the numbers. So it's going to be the data points. We need to really have almost information coming in from each of our districts, blocks, and almost villages level, data coming in real time for us to strategize forward and say, I can release a little bit of the lockdown here, allow some activities to take place, but be very, very careful, always be vigilant to make sure that the moment I get an uptick, we are ready and to enforce the lockdown.
Okay, I take what you're saying. Let me actually take it across to Dr. Pinto as well and ask him, Mr. Dr. Pinto, what do you think would perhaps be, the most viable option post April 14th?
So I absolutely have to agree with Dr. Pujari that there is no right answer, unfortunately, and everyone is trying to figure out the best possible way. I think what everybody suggested pretty much covers everything that we know so far. But in addition, I think it's also very important to know what the community prevalence of the virus is. We are learning more and more that there are a lot of asymptomatic patients across the world who are positive and remain asymptomatic. And until and unless we know that denominator, we know what the actual prevalence of the virus in the community is, it's difficult to plan accordingly. For example, Germany right now is looking at a strategy in which they look at individuals with antibodies and then kind of certify that these individuals are fit to join the workforce. These individuals can go out and work again, while as those who don't have the antibodies continue to stay at home. There's also a strategy looking at only letting the 18 to 35 or the 18 to 50-year-olds step out, the ones who need to run the workforce and who are at an extremely low risk of death from the virus. So I think these are also strategies that can be thought of in terms of a staggered release of the lockdown. The other thing that's extremely important that we must realize is no matter how we do it, no matter when we do it, wearing masks is something that we need to absolutely enforce. Physical distancing is something that we absolutely need to enforce. And avoidance of any gatherings and any crowds are an absolute must. So no matter when we do this, these rules, I think, are going to need to stay for a long time to come.
I'm sorry, if I can just take you back to the point that you made and ask you to perhaps explain it a little bit more to our viewers right now. The one about the antibodies and the antibody test. Why is that essential and what will that show? Because I think that's also something that the COVID task force and Dr. Guleria in the day also mentioned. Just help us understand that better.
So what's happening right now is that all the individuals who are getting tested are either symptomatic. So they have symptoms or they're manifesting a severe form of the disease, or they have been in contact with somebody who has manifested those symptoms in the past. What we are finding, what the initial data from Italy, from early data from Maharashtra as well, suggests that a lot of these individuals who are being tested just because they are contacts are asymptomatic and remain without symptoms for a long time. So it is therefore possible that a lot of individuals in the community out there have been infected with the virus. have remained asymptomatic and therefore not got tested. And if these numbers are high, then the actual prevalence of individuals who have a severe form of the disease, we would realize is actually low. What would happen as a consequence of this is those individuals who test positive for antibodies, who've had the virus, who've been infected, who've remained asymptomatic, who had no problems whatsoever, can kind of be assumed to have some sort of immunity against the virus and therefore are safer to come back into the workforce. Of course, we don't know yet the data about reinfections. We don't know whether there's a possibility that something might go wrong down the road. But based on what we know about most viral diseases, if you are infected, you have antibodies, you generally tend to have some sort of a protective effect, which would probably enable you to rejoin the workforce.
Okay, let me actually turn this conversation around a little bit and approach it from a different angle. Dr. Pujari, as of a couple of days ago, the information that we had from the government was that we've so far tested about 80,000 samples. Now, I'm assuming this includes the repeat testing that's happened in a few cases. Irrespective, 80,000 samples for the size of a country like ours. Is it even too soon to start looking at options for post-April 14th, because we don't even know yet what is the extent of spread out there, or do we know that part?
So right now, I would tend to agree that the number of tests that we have been able to do is maybe not proportionate. But what is important that one needs to look at is the testing that we have done in are individuals who have a high risk of having a COVID-19. So these are not from general population. They already have some high risk. And if you actually look at the trend of percentage positivity, the number of patients, the percentage of patients who turn positive vis-a-vis the total number of tests, it's not very high. It has remained kind of between 3 to 4%. So essentially what you're seeing the spike in numbers is because the absolute numbers are high, because the absolute tests are high. But the percentage of the population which is actually coming positive is the percentage is quite similar. So if you want to extrapolate it to a low prevalence population like the general population, then it may not be really quite beneficial to test extensively with the current RT-PCR, which is a technically difficult test and which is an expensive test. So what government has done is rolled out antibody based tests, which you can, and we have basically developed guidelines for how to use the antibody test even for diagnosis, and also to look at what is the prevalence of as Dr. Pinto mentioned, the prevalence of asymptomatic infections in the community. So over the next, if I remember correctly, over the next 3 to 4 days, we are going to extensively roll out, because ICMR is going to get about 1 million test kits, the antibody based, which will be rapidly rolled out in various parts of the country. And at that point of time, we will have further data to really support what we can do post the lockdown.
Okay, I was just looking at what some of the other countries have done, and while some of our experts also pointed out, in some cases the lockdown has continued for a much longer time. For example, in Italy, it's still on. In other cases, they're doing an odd even kind of a lockdown. For example, in Israel, in other cases, the lifting of the lockdown has begun, and it has been in a staggered manner. Suffice to say that there will be some hotspots, Dr. Jessani, which will perhaps see restrictions for a longer period of time. For example, let me just talk about what's happening in Mumbai. In Mumbai, we are still discovering, a lot of cases on a daily basis. We are touching a new high. 100 cases one day, 120 cases another day. So we are still understanding and discovering the extent of it. It's highly unlikely that we will be able to get back to normal life anytime soon, isn't it?
See, if you look at the epidemiological curve of what India has been going through, it's not that the cases are scattered everywhere. If you look at the cases are always there in small clusters in various areas. So what I am in favor of, instead of a nationwide lockdown, let's have a local lockdown. Let you identify where are the cluster of cases where the cases are present, And the lockdown should be there in those areas with the help of local community. You can have lockdowns. For example, in Mumbai, if there are few sectors of Mumbai where there are cluster of cases, have a lockdown over there, release the restrictions very slowly, and maybe in other places where there is no cluster of cases which has been found out, you can release the lockdown. Because if we release the lockdown in its entirely one day, again the number of cases will increase, and again we will be going one step backwards. So what is needed is a staggered release of lockdown, a gradual release of lockdown, and the lockdown should be released very gradually in those hotspot areas compared to other areas. That's what I believe we should go ahead with that for fashion.
Okay. Okay, I just want to bring the attention of our viewers and our panelists to what happened in Bhilwara, and if that can be used as a model in Bhilwara, viewers. We actually saw in a private hospital doctors and staff members who tested positive around March 20th. And immediately, to really clamp down on this entire situation and avoid further spreading, we saw that they imposed a strict curfew from April 3rd. There's been a very strict curfew. No one is allowed to step out of their homes. All the lockdown passes were cancelled. Even your daily essential items are being delivered at their residence, at the houses. People are not allowed to step out. And now they've reached a point where they are seeing lesser number of cases. So I want to just understand how this worked, and then maybe if we can look at replicating this model in some of our other cities. Let me actually go across to the collector and DM of Bhilwara. Mr. Rajendra Bhatt is on the phone line with me. Mr. Bhatt, can you just explain to us, what the initial findings was, and how did you decide on implementing this strategy?
Vara was a typical case where the doctors, nursing staff, they were infected. And doctors were the reputed physicians. They were seeing n number of patients every day. So when the record was taken, nearly 7,000 people were, treated by them in last 14 days when they got infected. So, and when they came on 18, the doctor came to the general hospital, district hospital on 18th, complaining about the chest infection, and he was breathless. So our doctors here, they were just able to find it out that this is a positive corona case. And though the test reports will come next day, they send the samples. But they were quite confident this is going to be a positive case. So on 18th only, we started our whole, strategy. The strategy was, first of all, curfew, locking of the city boundaries, locking of the state boundaries. So this was very essential. The border was sealed immediately. Neighboring districts DM were requested to seal their borders with Bhilwara, so it will be a double check system. We requested government to stop the railways and roadway services and the movement of private vehicles. So everything was, that is, the steps were to make the district isolated from other district to other part of the state. And one of our neighboring district is Neemuch, which is MP. So we also requested the DM there. Secondly, the list of patients were not just confined to our district. There were 13 districts patient in those lists, which these doctors has treated. So the list was sent to these 13 districts, 4 states, especially out of these 39 patients from other states. 32 were from Neemuch only, two were from Ahmedabad, one was from Surat, then Himachal, and one was from UP. So it was, and secondly, the doctor's patients list was with us, which he saw these patients in the hospital. But at home, the doctor was having a private practice, and there was no record of this. So there were, we were in a situation where we thought that survey, screening, combing, and then testing at a at a war foot level was necessary. So, and ruthless containment was a necessary step. So, what we did was the epicenter, the containment zone, and the buffer zone. We turned them into no movement zone. And the COVID positive cases which were coming, we had a cluster mapping was done. 6 areas were identified, and special team were deployed for continuous screening of suspected cases. We had a disinfection strategy also, containment zone, buffer zone, locality of positive cases, all ambulances, police vehicles, and screening center and quarantine centers were every day they were sanitized, disinfected, and even collectorate, police line, and other public dealing offices, city wards, and we gave a schedule to each of our citizen that of Bhilwara that these are the dates when the vehicle will come and sanitize your area. These are the dates when vegetables and fruits will come, and you will be given fruits and vegetables at your home, or you can make social distance circles and then can stand and get the things. For ration also, dates were given that these vehicles will come. We acquired the vehicles, made the facility for everyone. Then we had a screening strategy also, because the first positive people came from that particular hospital. So survey teams were trained and specialized by specialized doctors and regarding COVID and highlight symptoms, checking persons having foreign travel history. They were trained for prioritizing epicenter affected population as well as migratory population. Teams were given clearly demarcated areas for conducting surveys. There was a supervisor appointed on every 10
Okay.
survey teams. So this war room was established. There were many control rooms with the support of state RRT, WHO, and police. Screening and testing was prioritized for Bangad Hospital also. ICU patients and IPD and OPD patients were screened first. Then the persons who were identified to have contact history with those positive cases, then health workers and other staff of that particular hospital, and screening and home quarantine of all
So,
suspected
Mr. Bhatt,
ILI cases. Yeah. Hello. Is the voice
Mr. Bhatt, if I can
clear?
ask you, this sounds like a large-scale operation, much needed, of course, and seems to have worked as the numbers suggest for now. But if I can ask you, what was the biggest challenge? Was it, getting this sanitizing and safety equipment? Was it ensuring that people get their essential items still, because you're not allowing anybody to step out, to ensure that in a safe way everything gets delivered to them, that there is no panic? What was your biggest challenge in implementing this kind of a model?
First of all, the biggest challenge was the unknown people. We were not knowing those patients who were seen by the doctors at their homes. We had no record of that. So that was the first challenge. And the challenge was to seal the boundary so nobody goes out. Nobody having this, infection goes out to other districts of the state or in any other states, nearby states. So this could have been, epidemic burst at that time. So first this was this, then second was to make the people understand that their health was the main concern. Even though we are confining them, we were having this ruthless containment principle. We are confining them to their homes. We are forcing them not to go out. We are convincing them. So first of all, the people were not convinced. Then they came to know, because during the survey, they thought there is something which can happen in such a way which will be a disaster. So the survey team educated them. They told them this. They gave the IEC material also. Told them
Okay.
about the symptoms and told them to come forward. If anybody, don't worry about that whether you have COVID-19 or not, whether you are positive or negative, come forward. If you are having these symptoms, come forward. We will test you. You will be kept in isolation, but you will be safe. Your family will be safe. And this message throughout, and the message given by our Chief Minister every day on the television, the health minister every day on the television. Then on the social media, myself, all my colleagues, SDMs, they used to pass on the message. Every day, social media, I'm giving, a great credit to the television, the print media, and the social media for making the people aware. And that was the reason people now participated in our war. And they become the part. They are now very much in their homes. Hello.
All right. I really appreciate Mr. Bhatt for you speaking to us. Thank you so much for taking the time out and explaining this to us. Sounds like a mammoth task, and actually, speaking to you helps us understand just how difficult it is, even for the authorities, even for the government officials, the civic body officials, the police, the healthcare workers, everybody to come together in such a scenario to ensure that everything just matches and works perfectly fine. Rajendra Bhatt, thank you so much for speaking with us and telling us how you really implemented this and carried out in Bhilwara. So if I can actually go back to our panelists and ask them this question, and maybe Dr. Pinto, I can start with you. Is this a model that can be replicated in other parts of our country now?
It's fantastic what Mr. Bhatt just described. I think it's the effort has to be lauded, and it's really impressive that they managed to do so much. To me, as somebody who's not involved in policy, this looks very, very labor intensive. It looks difficult to do in more densely populated areas. But if it is feasible, I think this is a great model. Of course, the economics of it would be a different story altogether. To shut down a city, to prolong the shutdown, to not let people earn their livelihood, I really don't know what the implications of that are from a public health perspective. But whatever they've done there seems to be fantastic, and applause to them for doing such a fine job.
Yes, in fact, in many other parts also we are seeing this example. If I can just actually also tell our viewers what's happening in Chandigarh. So in Chandigarh also they have ensured that there is door-to-door delivery of essential items, so the people are not really stepping out. Perhaps it is possible in places which are not highly densely populated, where you can actually have a plan, a schedule that's given out to people. Bus arrives, in a block of 4 to 5 houses. People can come to that bus, buy the products and go back. Perhaps not possible in crowded cities like Mumbai. Then what do you do? Dr. Preeti Kumar, what's your own sense? Is the Bhilwara model workable in some of the hotspots in our country today?
So the Bhilwara model would definitely work in a situation which shared similar demographic and epidemiological and geographical situation of Bhilwara. However, as you rightly mentioned even earlier, our responses will have to be very graded. It wouldn't work in an area, for example, if we would in an urban slum like Dharavi. So therefore, we really need to understand a more health system strategy would be needed, where there is an interplay of three players. A health system that actually is moving from house to house to ensure that we are testing and rigorously doing contact tracing. That is the first element. The second one is where the government steps in and not only provides the overall administrative government structure, but also a safety net to ensure that people get their food and their essentials that can be provided to them. How it is done with a Bhilwara model would work in some areas. You might have to customize it for other areas. And the third is the social contract with the people themselves. That is, of course, common across all populations until the community is convinced that it is being done for their protection, and provided that they get their essentials and they are informed that if they can come forward, if they can get tested for it, and also informed that they may have come in contact with somebody else, so this whole process might become expedited. And that is the only way of moving forward and making sure that we have a graded response to this lockdown. In Bhilwara, they threw everything they had and it worked fantastically. But as rightly pointed out by one of the speakers, probably moving ahead, this can only be done in spurts. At some stage, we would need to arrive at a balance where a lockdown has to be sufficiently stringent to enable that there is no, that a health system does not get inundated with patients, that we keep the number of patients and the number of COVID positive low enough, while also freeing some part of our population, the low risk population, the population that probably through screening tests might come to understand that they are now immune, and get them back into the workforce.
Okay, Dr. Pujari, would you want to also help us understand how that could be possible? Maybe give us an example of a city where it's workable and where it's not. I find it difficult to imagine in a city like Mumbai, how would you lift the restrictions in a staggered way? The movement is from one corner to the other. It's highly densely populated. I mean, the idea of perhaps restarting local trains itself sounds a little, tricky at this point of time. So where can we see partial lifting of restrictions? What could be the setup for those cities?
So I'm not really very well versed with the implementation aspect of this, but essentially I think the better way to start is to try to lift up staggered lockdowns in areas which are not hotspots, and really observe very carefully, because the problem with any kind of hasty removal or any kind of hasty implementation of an exit strategy can actually lead to re-emergence of the virus, and the second phase of that re-emergence can really cripple systems. So essentially, this lockdown, I think personally, has been an extremely successful lockdown, in the sense that it has been able to plateau. It will flatten the curve, but it also gave us a lot of time to develop our healthcare infrastructure, as well as gave us time to get testing more rigorous. Now we are testing more. So essentially, I think we have bought time, and we are prepared for the next phase of this epidemic. I think we have to be creative. One solution, one pill does not really, one size does not fit everybody. So for every different areas, we have to be innovative, creative, and try to develop explore models as the epidemic progresses, of trying to develop an exit strategy. But the key element in all the exit strategies, that whatever we may be able to do, is community support. Unless we have people involved and everybody feeling that they are part of this effort, any exit strategy may not really work.
Okay. I will take a shot here and ask you this question. Into your mind, in your expertise, Dr. Pujari, people are right now wondering if starting April 15th, they should start looking at making their travel plans. Many people who are stranded at one place, need to get to another city in our own country. Domestic flying, bus tickets, flight tickets have started, but we don't know if the lockdown will actually be lifted. In your expertise, does it look like a possibility? It's 6th of April right now. Does it look like a possibility that on 15th of April we'll have people flying about?
I'm not sure I'm the right person to answer that. Right now, we are still waiting for the rapid, the testing data. The rapid testing data may perhaps come by some time, some few days. We will have the mapping of what is the situation, and then perhaps we would be able to be in a better position to take a call like that.
Okay, so the rapid testing kits we're given to understand will perhaps begin to arrive from Wednesday. And so by the time we get them to different locations and to these specific hotspots, and then have some data in, will be a few days at least, isn't it?
Yes. So it will be by this weekend. Maybe we will be able to have large amount of data to work on with.
All right. My last question to Dr. Jessani before we wrap up this conversation. Dr. Jessani, going forward, do you believe, at least in a long-term basis, and I'm not talking about an absolute lockdown or otherwise, social distancing is still here to stay, because we don't really have a cure yet for COVID, and until unless that happens, perhaps the best way to go forward is for the people to understand and the society to understand that we need to maintain our distance and be precautious.
Yeah, that's right. What you're mentioning is absolutely correct. But let us have a practical view at how can we exit from this lockdown. So let me give you 3 steps in which we can have a practical view how can we exit from the lockdown. The first step is test, test, and test. The more people we test, the more cases we identify, it will be better for us. Either we use a PCR-based test or we use the rapid antibody testing. The more people we test, we come to know what is the exact burden of the disease and where are the cases. Step number 2 will be contact tracing. So once these cases are identified, their respective contacts, there should be a strict contact tracing which should be done, and testing of these contacts should be done. Once we have this mapping of these cases and the contacts, we will have a good overview that where are the clusters of hotspots. And once we get an idea where are these clusters of hotspots, third step would be to impose this local lockdown. So in these clusters of hotspot, we can have a local lockdown where the restrictions are not lifted completely compared to other areas which are cold spots. There we can gradually remove off the restrictions, and in these hotspots we need to be very stringent, because if we remove the lockdown earlier in these areas, there would be a second wave of new cases which probably will not be able to control once again. And as you mentioned the point regarding social distancing, I think this is here to stay, and it will take some time before we can again gather in groups. I think the message should be very clear that we need to maintain social distancing so that at least we can prevent the local transmission of the infection in the community.
Yes, absolutely, and I think we cannot emphasize on that enough. Lockdown may be lifted completely or in a staggered way in a week or in a month from now, but we need to understand that social distancing is here to stay for a while, and we'll just have to, get used to it and convince ourselves that going forward, until unless there is a cure for this disease, there is no other way. Thank you to all of our esteemed panelists for joining us on this conversation. It's been an enlightening conversation here to try and understand what could possibly be the way forward. And viewers, there is no point in speculating, and that was not the idea at all, to speculate what will happen for a week from now. That's for the government to decide, but you heard the experts. We still need a lot more data before a decision can be taken, and that would go for the government as well. But there are many options available, and perhaps in a week from now we'll know which one of these options is the most suitable for our country right now. Thank you so much for joining us on this conversation. On the other side, we put the spotlight on masks. The government says people should start making their own masks. How can we do that? What do we need? That's the big focus. Stay with us. Well, a vendor who sells tea near Matoshri, the private residence of the Maharashtra Chief Minister Uddhav Thackeray in suburban Mumbai, has been found positive for novel coronavirus infection. A vendor, a tea seller near the Chief Minister's residence in Mumbai, has been tested positive right now. What are the kind of precautionary measures that are being taken? Let's go across to Kajal, who was at that location just a short while ago and is joining us with all the updates. Kajal, take us through the details.
Tanvi, I'm actually back at this particular location, which is near the Chief Minister's residence. It is around 50 feet away from the Chief Minister's residence, and barricades have been put up. And just stay with me for a bit, because I am seeing this entire posse of policemen that are actually being taken into this particular spot right now. Behind me, you can see those barricades. And the policemen, they are being taken inside. I'm not sure if it is visible through my phone camera, but several policemen actually going there inside at the barricades. Yes, so we are being stopped by the cops right now because it is a containment zone, and so you can see that the containment zone has been declared very, very close to the Chief Minister's residence, and that is why it has raised the hackles of the authorities, because most of the cases that have been found in the past few days have been people of the strata of this of the kind that this tea seller has been. It has been people from the slums of Mumbai. It has been people who are, who are food stall vendors and stuff like that.
Okay, Kajal, if you can just also describe to us that locality, just how far away from the Chief Minister's lane itself, residence lane itself, was this tea cellar? Is it a completely residential area? I also understand that the civic body has already come and sprayed disinfectants in that zone.
Yes, in fact, disinfectant and sanitization was done in the evening itself today, and the barricaded entrance is actually about 100 meters away from the chief minister's residence, and a little bit ahead is a place called Shada Vidyalaya where this tea cellar was. So we can look at a distance of I think around 250 meters away from the chief minister's residence is this particular tea cellar. So yes, very, very close to the chief minister's residence. But the main entrance to Matushri is still open from the entrance that the chief minister and his family uses to get in and go out. That entrance is still open. But yes, this does abut the general Kalanagar area, which is why the authorities are taking extra precautions.
All right, Kajal Iyer, they're bringing us these updates from Mumbai, where now very close to the residence of the Chief Minister, there was a vendor, a tea seller, who's tested positive. And like Kajal was pointing out, in this zone and from the strata that he belongs to, there have been quite a few cases in the recent past. So all precautions right now being taken. We'll keep a close eye on that story. But let's move on and put the spotlight on what I promised you, what to do to get your own mask. Can you really make it at home yourself? What do you actually need? And we're talking about this right now, viewers, because while for the longest time the government said, and the health experts have been telling us, that only the medical experts and the people who either have cold and cough or any other pre-existing medical condition and so have a low immunity should be wearing a mask. But a couple of days ago, the government did come out with an advisory saying that there have been few other countries in the world where people wore mask en masse, and everybody was wearing one, where they are seeing a lower number of cases. So perhaps it's also something that works and we can look at. And so people who are stepping out of their homes right now should start wearing masks. Now that doesn't mean that you run to your nearby chemist store and buy an N95 mask. Please leave those ones for our healthcare workers and our frontline corona warriors, because they need it the most. In fact, Times of India has initiated a campaign as well called the Mask India. So if you are going to be with us for the next 10 minutes, you can understand how to do it yourself, and you can then also join this campaign called #MaskIndia to help us understand what do we need and can we really do it at home. Dr. Uman John, public health expert and senior researcher with the George Institute of Global Health India, and Dr. Vijay Lakshmi, senior consultant for infectious diseases at Kaveri Hospital, joining us from Chennai. Dr. Vijay Lakshmi, let's start with you. A lot of people are wondering, what does this mean? Can I just pick up any cloth, wrap it around my face and step out? Do I need to put something in it? What is this make your own mask concept?
See, there are several kinds of masks. Basically, we have to understand during surgeries, we use a mask. That's basically to prevent whatever problems we have entering into the patient. That's how the mask started. Then we had an extra layer so that if something is there in the air, it doesn't enter. That's a usual surgical mask. Now, the idea is when somebody is sick, wearing a mask prevents the things getting aerosolized. Others may not get it. That's basically logistic. When the numbers increase in the community, you expect everybody to have a mask. Basically, the idea is, my secretions don't go out. Your secretions do not reach me. That way, everybody gets protected. So everybody going out wearing a mask may prevent the spread from one person to another, especially when the community spread is quite high. I'm not really sure whether we reached a stage, but we should probably start doing it because you need to be used to wear a mask. Otherwise, if you keep meddling it with your hands, there's a higher chance of infecting yourself. So when you use a mask, you need to make sure you don't meddle with it. And once you feel it's done, it has to be taken off and washed. Wash it, put it under the sun, reuse it. You can make it at your phone. You can even wear a handkerchief or anything around your nose. But the moment it becomes wet, it becomes useless. So please remember that.
Okay, That's very interesting. If I can also go across to Dr. John and ask him, Dr. John, what if people are not able to access a mask from the nearby chemist store, not even the N95, but the regular ones, if they are also out of stock, is it something that we can look at making at home?
Absolutely. So what's been advised is that to make your own mask, definitely don't go to the shops to buy them. So you can take any cloth. That is, it could be an old T-shirt or something, but it has to be clean. So make sure before you make your mask, you clean that and use a clean cloth. And you just need some straps at the end. You can use old shoelaces or anything, but make sure everything is cleaned and dried. And you just need to cover your face. So like Dr. Vijayalakshmi said, that it is very useful when you want to prevent yourself. Suppose you have the infection and you do not know, you don't have any symptoms, but you are still going out. You shouldn't be in the first place, but if you're still going out, you would prevent infecting others. Secondly, if there is somebody else who's coughing and or sneezing, the chances of that coming onto you is reduced significantly if you have a cloth mask. The other thing is that when a lot of people are wearing masks, a positive image about the need for this going around will also be there. So many of the advisories have also told about the collateral benefit, that when you see, you are reinforcing the message that this is something serious going on, everybody take care. Again, the advisory from the government says clearly that mask alone is not going to help. You need to take other precautions, such as washing of the hands, not making sure that you don't touch any surfaces, and if you do so, immediately wash.
Okay, but obviously, as we learn more about the disease itself and the infection and how it's spreading or what can be done, some of these guidelines will change. But to begin with, Dr. John, we were told that, unless until you have a medical condition, you don't need masks. Yet there are reports that in some of the countries like Japan, it seems to have helped them in reducing the number of cases. Is there any widely and officially accepted evidence of whether or not mask stops the infection, or is it simply to ensure that we don't spread the infection?
So there has been a study that just come out in the last couple of days where they have studied over a period of about 5 years about aerosolized particles and the role of masks in preventing that, and that's just about come. The evidence is not very strong in terms of large numbers, but that is one. Two is that if you look at the analysis, again, this is anecdotal, it's not hard evidence, but if you look at the analysis of the countries that have gone in for masking of everyone and ensuring that everybody has a mask, such as Singapore, even South Korea, China also had an aggressive mask campaign, and Japan as well. So they seem to have done extremely well, but they also combined it with other strategic approaches such as extensive testing and going behind cases. So still we have all of the data and hard evidence. We can't say what is this like body of evidence that is the thing. But if you see the CDC guidelines, the France guidelines of late, the guidelines from the Indian government itself are all pointing towards masking, and universal masking is good.
Okay, so universal masking it is, and then we are also headed towards that direction. A simple clean cloth, and if you have means to attach bands to it to tie it around your face will do, but you have to keep in mind that there are many other precautions also you have to take. Don't touch anything when you get out, don't touch any other surface when you're buying your essential items, and the minute you come back, you must completely wash up and wash the cloth. Any other precaution that we can take, Dr. Vijayalakshmi, while stepping out?
You don't touch your face. That's the most important thing, because if somebody spreads the virus, they have to cough it out. They have to touch the surfaces. You have to touch the surface and then touch your face. So what is in your hands is you need not touch the surface, and you need not touch your face. So most important thing is mindful avoidance of touching your face. So when you go out, make sure you don't touch your face. Come back, wash your hands. And the moment you feel your mask is wet, wash your mask. Please do not reuse mask every day without washing. The whole concept fails then. You have to keep washing your mask, drying it in the sun, and then reusing it. Make sure you wash hands, make sure you don't touch your face.
Okay, there is one other question that many people have asked, and people often wonder when they go out to buy their groceries, should they be disinfecting every packet, or is it all right and safe to bring in those packets and then use them as is? Because the minute you touch that, is there a possibility that on the surface of that bread or cheese or even the milk Tetra Pak, there is some infection and some virus?
Make sure it is clean. If you have a milk packet, wash it. Once the vegetables are cooked, the virus dies. So you actually make sure your salads are clean. You make sure you skin your scallops, fruit, skin it off. You cook your vegetables well. The moment it becomes cooked, the virus dies off. Similarly, when you have packeted food, you can just clean it with fresh water. That's more than enough. That will kill the virus. If you're really worried about something being contaminated, you have somebody coughing around, put them under the sun for some time. Then you can take it inside and use it up.
Okay, before we wrap up this conversation, any other suggestions, Dr. John, that you have for people right now as we start off this Mask India campaign? What should we be keeping in mind?
So the absolute necessity is to stay at home. So you need to only go out if you have to absolutely dire circumstances make you to go out. So it's assumed that all of us would be staying at home, and maximally we would be at home. If at all you do have to go out, then wear a mask and go.
Absolutely stay at home. Yes, of course, that is the most important point, that people need to follow this lockdown restriction, and we cannot emphasize on it enough that we have to observe it. The social distancing and completely cutting ourselves off from the world is perhaps the only way right now to defeat this. Physically speaking, cut yourself off. You still have digital media and internet to keep you connected, your mobile phones to keep you connected. So I'm going to thank both of our panelists for joining us on this special conversation right now. Homemade masks can work as well. This is to ensure that you don't spread infection and you don't get any. You don't need the high quality medical masks that the medical staff needs, that the healthcare workers need, who are going to be treating the patients. So as we launch this campaign, and as the government asks you, keep this in mind that we are going to be, you can actually make a mask at home. Just use a clean piece of cloth and that's going to be enough. Don't fret if you can't find a mask at your nearby chemist store. You really don't need that kind right now, is what our experts are telling us. I'm going to thank both of our doctors for joining us right now on this special conversation. Let's get you some interesting reports. And earlier on this show, viewers, I highlighted to you how there are still a series of people, politicians, officials who are disregarding social distancing norms. Here is an example that's coming from Jammu. Senior officials completely flouted social distancing rules just for a photo opportunity. They had actually gathered at the government medical hospital to install a sanitizing tunnel. But as you will see in the report, and you can see the visuals as well, they maintained absolutely no social distancing at all. The whole point of it was lost. Here is a report that Pradeep Datta sent for us.
On one hand, they are claiming that they are providing sanitizers so that there's no contamination, so that people do not carry any kind of germ. On the other hand, you can see the kind of the violation that is going on. This is simply a violation. They're violating those social distance norm, because reason being that all of them had been waiting for the Commissioner Secretary Health to arrive, and during the process you can see large number of people have already gathered there. There is no social distancing as per social distancing norm. People have to stay just few meters away from each other. But here you can see everybody is jostling for that space, because they are trying, they're more for the publicity rather than for caring for the disease. Already there had been spike in cases, and in most of the cases it has been seen that the people who have not maintained the social distance, they had been responsible for that. But when authorities fail to understand this thing, so how come you are going to generate awareness among common masses, especially from the rural areas and the illiterate people who hardly have any idea about this thing? Totally that social distancing is being in fact violated by the officials here, because they wanted to inaugurate. This is not the time when you have to go for the publicity publicity, or you have to go for any kind of optics, or you have to go for any kind of a publicity stunt because you want to here inaugurate. Already here in Jammu region, people are late in installing these sanitizers, while as in Kashmir Valley it has been installed long back. But despite that thing, they are trying to make it a big event. They are more for optics, they are more for the photo obsession, and you can see in the process, this is what exactly how they are maintaining a kind of a social distancing here at the Government Medical College here in Jammu. This is complete violation. Who will be really answerable to this thing? If tomorrow there is not, one can't deny this fact that there is every possibility somebody from here must be carrying infection back home. Then who will be responsible for that? Authorities who kept people waiting for inauguration of this sanitizer here at the Government Medical College, or somebody else?
Well, from Jammu, let's also shift our focus to Kashmir, where in this current state of lockdown, the idea is to deliver the essential items to the people's homes, but that's actually become a huge problem. Departmental stores assigned for home delivery in Kashmir are facing challenges, as several people they claim have been asking for items which are not on the essential list. So now actually these stores are seeking the help of the administration, saying, give us a solution so that people actually only demand what is completely essential at this point of time. Fareed sent us this report.
Well, the step of the government was welcomed by one and all when they roped in departmental stores, big chains in various areas to go for home delivery to a radius of around 3 kilometers. While that was good, and these people have already started this. Now, right now I'm in the back store of the 7-Eleven departmental store, which is one of the biggest chain and caters to almost 3 to 4 kilometers of the civil lines. Now, this is though free distribution. These packets that they are making is for free distribution via government, but the issues that they face, they tell us that the government, while it gave out their numbers to the people for home delivery, but to add to that, there should be a list of essentials that should be out, what the people can really demand or order from these stores and what they cannot, because now the issue that they are facing is that while there is a lot of flow of calls, people demanding and people ordering, but then there are also people who really deviate from the essentials and are demanding things like cigarettes, like hair color, like dog food. So that is something that in this hour of crisis they cannot provide, and a lot of time is being wasted on that particular aspect. So obviously the government needs to come in, bring out and publicize a list of what the people can get from the departmental stores through home delivery and what they cannot. Now I have with me Mr. Sajjad, who runs the 7-Eleven departmental store. Let me ask him what are the issues. Various issues. Obviously you did not or were not into home delivery, but you started this mechanism in a very short time. What are the issues that you're facing, and how much are you catering? Have people been responsible in their orders? How do you see this?
लोग तो रेस्पॉन्सिव नहीं है, कुछ लोग समझते हैं, कुछ लोग समझते नहीं हैं. हमें जब गवर्नमेंट ने बोला है कि आपको होम डिलीवरी स्टार्ट करनी है, हम पर्टिकुलर डिपार्टमेंटल स्टोर्स इस लिस्ट में रखते हैं और इसमें खाली आपको एसेंशियल कमोडिटी प्रोवाइड करनी है. लेकिन लोग अवेयर नहीं है इसमें एसेंशियल कमोडिटी ऑर्डर करना है, कैसे करना है, हमें क्या क्या ऑर्डर करना है. हमें कुछ ऑर्डर्स ऐसे आ रहे हैं कि जिसमें आप क्या समझो, जिसमें ऐसी चीज़ है जो एसेंशियल नहीं है. हमें कस्टमर बोलते हैं हमें डॉग फूड चाहिए, हमें पेडिग्री चाहिए, हमें विस्कास चाहिए, हमें आइसक्रीम चाहिए, हमें केक मिक्स चाहिए, हमें केक बनाने के लिए हमें कुछ सामान चाहिए. हमें ऐसी चीज़ों के लिए ऑर्डर्स आते हैं जो हम प्रोवाइड नहीं कर सकते हैं. हमें सिगरेट्स के लिए ऑर्डर आते हैं, वो बहुत फोर्स करे कि हमें सिगरेट्स दो ही दो, प्लीज़ हमें सिगरेट्स दो ही. हम घर से बाहर नहीं निकल पाते हैं. हम उसमें बहुत हमें मतलब तकलीफ़ हो रही है कि मुश्किल हो रहा है हमें कैसे उसको कैटर करें. हमारी डिलीवरी जो है हम सुबह स्टार्ट करते हैं, शाम को 11 बजे तक डिलीवरी प्रोवाइड करते हैं कस्टमर्स को. जो भी हमारे पास डिलीवरी मतलब ऑर्डर्स आते हैं, हम एक ही साथ उनको पहले कंपाइल करते हैं, फिर देखते हैं किस बीट का है. सपोज़ हमारे यहाँ पे 3-4 एरियाज़ है जहाँ पे हमारा रूट है, हमें गवर्नमेंट ने बोला है कि खाली आप 3 किलोमीटर रेडियस के अंदर आप दे सकते हो, उससे ज़्यादा हम भी नहीं कर सकते हैं. उसके नेक्स्ट में जो नेक्स्ट डिपार्टमेंट स्टोर होगा वो कैटर करेगा उसको. हमें फिर वो फोर्स करते हैं, सुबह फ़ोन करते हैं, जी हमने ऑर्डर किया है, वो आया नहीं अभी तक. 1 घंटे में फ़ोन करते हैं, अभी आया नहीं. कुछ लोग समझते हैं लेकिन सभी नहीं समझते हैं.
Well, here's another report, this one from the national capital, where the first drive-through test facility has been set up. Now, anybody who registers for a testing can drive in, given the samples, and drive off, and they will get their test results in 3 days. Here is a report that Prashant sent for us.
India's first drive-through corona testing lab has been set up here in the national capital at a time when the number of cases are exponentially rising with every passing day. This sort of testing lab is something that many believe is going to help the government in testing more patients, because testing more patients is something that is the need of the hour. You can see I'm standing in Punjabi Baghi right now, and Dr. Dang's lab has started this, in which anyone who registers for a test here will be driving here at this particular location. It's a drive-through, a proper drive-through that has been made here. The car stops, the tests are done all with patients sitting inside, the suspect sitting inside. The samples are collected, it's sent to the lab for further testing, and that's exactly how the procedure is followed right here. Now you can see this car has been brought here, it has a suspect inside it. These are the people who have been deployed here to ensure the test is done. The collection process is on, the swabs are being collected, and this will be sent to people, to the testing labs for further testing, and after 3 days the result will be given. Now, if you talk about the people who are behind it, they say that this is being done to not only help the people but also the government to more aggressively test the patients, because testing is something that is the need of the hour, and that's exactly why Dr. Dang's lab has come up with this.
Well, as the Food Corporation of India plans to move about 5 million tons of food grains across several states in this current month, there is a lot of work that's going on in Rohtak, the epicenter from where this food is actually being sent out. Times Network's Siddhant Mishra brought us this report from the Rohtak railway station to really show you the story of the unsung heroes who are working tirelessly round the clock to ensure the rest of the country gets its food. Take a look.
लगभग 10 रैक ये लॉकडाउन के बाद हुई हैं, और उनमें लगभग 5-5.5 लाख कट्टे एफसीआई रोहतक डिस्पैच कर चुकी है, और ये माल मुख्यतः बिहार, यूपी और वेस्ट बंगाल में गया है। यहाँ आज भी रैक लगी हुई है, और सुबह 7 बजे से लेकर रात को 11-12 बजे तक रैक भरेगी। 100-150 के आसपास मजदूर हैं यहाँ पर, जो लेबर है।
Completely out of time. Thank you so much for joining us in this edition of the Urban Debate.